Hello, my name is Kevin Benson, and my Nova Southeastern University identification number is NO1974423. Just to reiterate that, it is NO1974423. To begin with your first question, why do I want to become an occupational therapist? I want to become an occupational therapist to continue my role as a mentor and teacher. I am an instructor at a martial arts studio called TUSA Martial Arts, where I teach both children and adults the martial art forms of Taekwondo and Hapkido. I oversee their physical and mental growth as an instructor. Physical growth is the activity that comes when practicing sports or anything that requires you to use your body. You will enhance your body and gain strength, endurance, and stamina. The mental growth comes when you enhance your mind. When I'm an instructor, I always teach my students the pillars of the martial art forms of Taekwondo and Hapkido. They are respect, loyalty, and faithfulness, just to name a few. But the most important one is confidence. Confidence in yourself, and that confidence that you carry throughout life. I always make it a strong point to teach my students confidence so they can encounter life situations with confidence and knowing that as long as they work hard, they can overcome any obstacle. This improves their overall quality of life because of the way that they handle life. As an occupational therapist, my role as a mentor and teacher would continue. However, I would add on roles as a healer and as someone that improves someone's overall quality of life in a very specific way. Through my work as an occupational therapist, I will give people the independence to live their life again. Occupational therapy to me is a way of giving someone their life back. I first encountered occupational therapy as a child when I required it through my elementary school up to high school years. I needed an occupational therapist because I had a learning disability, and at first, school was difficult for me. However, as my occupational therapist worked with me, I no longer required an IEP in high school, and I eventually went on from there to achieve honors. Occupational therapy is incredibly effective and changed my life. I have gained a passion for helping other people change theirs. And I want to do even more as an occupational therapist. Occupational therapy is different from physical therapy in that it is a specialized form of therapy that branches off from physical therapy. Occupational, or the word occupation, doesn't just stick with a person's chosen profession. It includes all the activities that we do in our daily life. These activities include feeding, bathing. Also, it includes activities that you do in your daily life, such as running errands, and activities that do encompass your professional or career life, and activities that you do in your spare time. Occupational therapy is a therapy geared towards giving a person their independence to perform those occupations again. Occupational therapy, therefore, branches off from physical therapy because its purpose is more specific and different from physical therapies, which pertains mostly to rehabilitation in the case of physical therapy. This is how I believe occupational therapy is different from physical therapy. I wish to pursue a doctoral degree rather than an entry-level master's degree to gain more knowledge as an occupational therapist. Knowledge can be used and allows a person to become an asset for not just whatever company they work for, but most importantly, the clients that they serve. I want to become a doctor in occupational therapy and, as a result, acquire a doctoral degree to gain as much experience as I can as an occupational therapist to help people and to be most effective in giving them their independence. I see myself in a very specific place in 10 years from now. I wish to work in the field of occupational therapy that deals with prosthetics or hand therapy. I wish to work with clients such as the veterans of our country and work with them after their military duties to acclimate them back to daily living. I see Nova Southeastern University as a key component in allowing me to do this because they will give me something even more precious and essential than even knowledge, which is experience. Although knowledge and experience are very important, experience gives you subtle nuances of how the field works, and therefore allows you to become the best occupational therapist that you can be. I want to fully utilize the experiences that Nova Southeastern University will allow me with their opportunities. I think that Nova Southeastern University and their doctoral entry-level program is different from other programs because of this experience. Their experience opportunities include 2,000 hours part and full-time clinical education and 3-week and 2-week internships, as well as a 16-week doctoral residency. This is experience in many different settings and even experience in different ways. I seek to pursue this experience to learn and work with occupational therapists in the field and leading experts in the field. Nova Southeastern University is different from other programs in the fact that other programs might not offer this exact same opportunity, and even furthermore, other programs do not offer the ability for a student to work with an occupational therapist at a doctorate level in the allotted time of 16 weeks. Online learning has been a positive influence in my life. I have required online learning for both St. Xavier University, for which I earned a degree in biology pre-medicine, and at my time at Moraine Valley Community College. I believe it takes accountability to be successful in an online course. You must work as diligently as possible as a student and ensure that you reach out to the instructor and work as a collaborative team to better your learning experience. Online learning, in a way, is no different from traditional classes in the sense that you cannot learn passively. You must learn aggressively. You must not just look at the course materials, but understand the course materials and know how to apply them. So if I were to summarize one word that I believe is necessary in describing anyone's success, and especially my success in online learning, it is accountability. The phrase, taking responsibility for your own learning, means that you do not need instruction on how you learn best. If you do not learn in a group, then you study in the best way you know how by yourself, whether that's through materials such as flashcards or reading the book carefully and actively. I also believe that the phrase, taking responsibility for your own learning, could also mean knowing what you need to do to attain success in that particular class. If you require assistance, to not just seek the professor's help, but to work with other students. Not just practice learning, but teamwork as well. That is what I believe, and that is what I think when I hear this phrase. Active participation in a learning environment. Working hard and even working with others. Cultural diversity and cultural competence is essential in occupational therapy because it is the means at which occupational therapists connect with people. Cultural diversity is the people that occupational therapists will interact with. Occupational therapists will interact with people from all walks of life. And cultural competence is how you effectively communicate with these people, with everyone, to achieve the desired outcome. A full regain of independence. Cultural competence must include treating everyone with respect, with courtesy, and the utmost professionalism as an occupational therapist. This will help you establish the necessary rapport between an occupational therapist and a client to get the necessary tasks done to treat the client. This rapport could also be termed the therapeutic relationship. Cultural competence is an awareness that an occupational therapist must have when interacting with people. In scenario 1, a particular group of classmates perform really well in an exam. However, the circumstances in which they perform are not entirely honest. They used a copy of the exam to perform well, whereas in this scenario, I did not, and I did not do as well. The professor, looking at the statistics of this class, curves the class. My reaction is with honesty. I believe that you must be honest in any situation that you encounter. So I would talk to this professor. I would bring this fact to the professor's awareness if the professor didn't already know. That way, everyone is on a fair ground for success. Everyone should achieve their success based off of their hard work and determination, not because a couple of people had a copy of an exam, whereas in this scenario, I did not. I would communicate with my professor, and then the professor can make an informed decision on whether she wants to curb the class or not. The second scenario involves a client and me as an occupational therapist at an outpatient clinic. It states that her surgeon has a poor reputation in the clinic. One day the client says to you, "I don't feel I'm getting better. Was my surgery any good?" What do you consider in attempting to resolve this ethical dilemma, and what would you say or do? I would carry the exact same attributes to this scenario as the previous one, which is honesty. I would communicate to this client that recovering from a particular setback, especially a surgery, takes time. It's not an overnight process, no matter how much we as people would like it to be. I would reassure the client that we're doing everything possible and that she is doing everything possible to ensure her recovery. However, I would also take an assertive stance and recommend in the next evaluation, where we measure her progress and write it down, that we see where it matches up with the previous evaluation that an occupational therapist must have when interacting with the client for the first time. If the evaluation is not indicative of the last evaluation, and what I mean by that is if the evaluation does not show progress and shows stagnation or decline, I would encourage my client for me to talk to the surgeon so that the surgeon and me as the occupational therapist, and most importantly the client, can work together to decide a desired course of action. I would communicate with my client always. I would address their concerns, and I would address them as in a professional manner as possible. I would not in any way spread any bad words of a surgeon, as of that is not indicative of professionalism. My strengths include my communication skills. I believe that if you want to achieve a goal, that you need to communicate with people. I use this in my job as an instructor all the time. I communicate with children, and I most importantly communicate with their parents about their progress and the next steps that we need to take for that child to promote to the next belt or rank in the martial arts program. And I also use communication to achieve group goals, as I did in St. Xavier University. We would work together to help set up for effective nights where science is the centerpiece. I would do the same in any setting that I am in. A weakness, however, that I need to enhance is my performance at standardized exams. I, unfortunately, have a weakness when it comes to standardized exams. Whether it be the test-taking strategy or the way in which I tackle and understand the question, standardized exams are not indicative of my performance as a student. However, I've taken assertive action to try and change that weakness. Working with a tutor to better understand test-taking strategies and how to apply them with standardized exams. I do not believe in letting the weakness define you. I believe in trying to work hard to improve that weakness and become a better person for it. The last question asks very simply why you, as Nova Southeastern University, should accept me in your occupational therapy program. And to you, I use one word to describe myself: integrity. I will work harder in your program to become an asset as an occupational therapist for not just your school, but the clients that I will work with in a future occupational therapy setting. I will utilize the resources at your university to better understand occupational therapy and to reach out and work with the top leaders in your community. I believe that knowledge comes when a person works hard for it. That opportunity is utilized when a person takes it at all its extent. I appreciate the time that you have given me and for this opportunity. I hope to hear from you soon and wish you a nice day. Thank you again.